A female with short stature is attending an infertility clinic with the complaint of infertility or unable to conceive. After a thorough clinical examination, the clinician advised for the karyotype, and karyotypes reveal only one copy of the X chromosome. So this condition is known as Turner syndrome. Let's discuss deeply about the Turner syndrome. Also known as Ullrich-Turner syndrome. In Turner syndrome, either complete or partial absence of second X chromosome. As we know, a normal female karyotype is 46XX chromosome. This is for the normal female. But in Turner syndrome, this one copy of X chromosome is lost, either completely or partially. So what is the etiology and genetics involved in Turner syndrome? There are three genetic forms of Turner syndrome. Majority of cases are because of the monosomy of X chromosome, complete or partial loss of second copy of X chromosome. Few cases show mosaicism, which is responsible for Turner syndrome, in which some of the cells represent normal female karyotype and some of the cells represent 45 chromosome with the loss of one X chromosome. Other chromosomal abnormalities include deletion, in which there will be ring or isochromosome can be responsible for the development of Turner syndrome. So these are the three major genetic forms. The most common one is monosomy X, then mosaicism and deletion, which include ring and isochromosome in one X chromosome. Another category or another genetic form which is very rare is bichromosome mosaicism. Presence of some Y chromosome material, not Y chromosome, some of the Y chromosome material, and this condition particularly has the higher risk of gonadoblastoma development. So these are the four genetic forms: monosomy X mosaicism, some deletion, and Y chromosome mosaicism. Prevalence of Turner syndrome is almost 1 to per 2500 live female births. Turner syndrome is an exclusive condition of female. SOX gene, this play very important role in the development of Turner syndrome phenotype. SOX gene, SOX stands for short stature homeobox gene. Haploinsufficiency of the SOX gene on the short arm of the X chromosome. As we know, SOX gene is responsible for the development of the long bones. But in Turner syndrome, we have only one copy of the X chromosome. That's why there is a relative deficiency of the SOX gene, which is responsible for the growth of long bone. Due to this decreased amount of the SOX gene, there will be a stunted growth. What is haploinsufficiency? Haploinsufficiency is only having one functional copy of a gene, which is not enough to provide normal protein level, as seen in the Turner syndrome. We have only one copy of the X chromosome, or the patient has only one copy of the X chromosome. What are the clinical features of Turner syndrome? Let's discuss. This image is given in Robbins, a very beautiful image which represents the main or common clinical feature or phenotype shown by a patient of Turner syndrome. As we can see, a low posterior hairline, waving of the neck, excess skin present over the neck, overall short stature because of the decreased amount of the SOX gene. In cardiac complication, there is coarctation of aorta, broad chest with widely spaced nipple, undeveloped ovaries, streak ovaries responsible for the primary amenorrhea or infertility, cubitus valgus can be seen, pigmented nevi can be seen, and peripheral edema at the birth can be seen in newborn in some severe cases. So, as we have discussed, short stature, female because of the decreased amount of SOX gene, ovarian insufficiency or failure resulting into streak ovaries, and this will be responsible for primary amenorrhea, delayed or absent puberty, and infertility. Waved neck, extra fold of skin over the neck is seen in Turner syndrome. Lymphedema, particularly in newborn. Low hairline at the back of the neck, as we can see, low hairline at the back of the neck. Broad chest with widely spaced nipple. These are the common clinical features seen in a case of Turner syndrome. Other health issues and complications which are also seen or associated with the Turner syndrome: cardiovascular defects, particularly coarctation of aorta, aortic dilation and dissection, hypertension, and bicuspid aortic valve. In renal abnormalities, horseshoe kidney, an increased risk of the urinary tract infection. In skeletal issues or skeletal system, due to the decreased level of estrogen, osteoporosis can be seen, and scoliosis and kyphosis is also noted in the patient of Turner syndrome. Hearing loss due to frequent ear infection and nerve issues, vision problem like strabismus and nearsightedness, autoimmune disorders. Patient with the Turner syndrome has higher tendency to have autoimmune disorders like Hashimoto's thyroiditis, celiac disease, and inflammatory bowel disease. Learning disabilities. Patients with Turner syndrome are particularly have a low intellectual ability. They face some mental health issues like anxiety, depression, and ADHD, attention deficit hyperactivity disorder. In cases of Y chromosome material, patient is on high risk of development of gonadoblastoma. Now, how we diagnose a case of Turner syndrome? In prenatal screening, ultrasound for the various structural abnormalities, non-invasive. In non-invasive method, NIPT is one of the very important and significant method in which we use cell-free DNA from the maternal blood, chorionic blood sampling, and amniocentesis. These are the prenatal screening test. Prenatal diagnostic test in which CBS and amniocentesis are confirmatory test. Karyotype analysis. This is basically gold standard for confirming the Turner syndrome at birth. Karyotype, as we have discussed, karyotype will represent the pattern or arrangement of chromosome present in a cell from chromosome 1 to 22 and followed by the sex chromosome, XX in female, XY in male. So this karyotype clearly represent only one copy of the X chromosome is here, and on this patient has 45 chromosome with only one copy of the X chromosome. So this is gold standard for confirming Turner syndrome at birth. FISH and DNA analysis to detect the mosaicism or the presence of biochromosome material. These are the helpful techniques. Other diagnostic tests like echocardiogram for cardiac anomalies, ultrasound for other structural anomalies, and hormonal tests for the complications. For the treatment, for the treatment of Turner syndrome, there are multidisciplinary approach which involve experts from the different fields: surgery, orthopedics, cardiology, genetics. Most common cause of death in Turner syndrome is aortic dissection or aortic aneurysm. So this is it for Turner syndrome. Thank you for your time. Thank you very much.